Hi, we're going over the Professional Dental Assistant, Chapter 3 today, Modern Dental Assisting. The qualities of the dental assistant are dedication, attitude, responsibility, initiative, and teamwork. You need to have these qualities to be a quality professional dental assistant. So let's go over these qualities and your personal qualities. So when you think about your personal qualities, how do you interact with patients or people right now if you don't interact with patients? Are you friendly? If you're not friendly, you need to think about that because when you're with patients, you need to be friendly. You need to be uplifting. A lot of people don't like coming to the dentist, and you can't, go up to them like Eeyore, like, hey, how are you? Let's go back. It's time for your treatment. You need to come out with a friendly disposition and be, sunny for them. Do you have a pleasant attitude? You need to have that pleasant attitude and, a pleasant tone in your voice. Use your phone voice. Everybody has a phone voice. Use that phone voice when you're with your patients. Do you listen more than you talk? Now, when your patients are talking to you, you need to listen to them. You need to understand why they're there, and you can't understand why they're there unless you're listening to them. You need to listen to their concerns. That doesn't mean that you have to sit there and listen to a half hour of them talking about everything under the sun, but it does mean that you need to be courteous and be patient with them. Are you considerate, respectful, and kind? Those are some things that you need to be with your patients. Do I control my temper? Of course, you have to control your temper when you're in a professional setting. You're in a dental office. You are expected to be a professional. You need to be respectful and considerate. You need to give your patients respect at all times. Sometimes you're going to have patients that are snippy with you. You need to maintain that professional attitude and keep your composure. You try to see it from their point of view. Sometimes patients don't understand what we're talking about or why we are charging them a certain fee after they've already paid. You need to see it from their point of view. Try to understand it and try to help them see the situation for what it really is. Now, when the doctor comes in the room and they say, oh, you need XYZ, and the patient doesn't understand our secret dental language, then you need to explain it to them in layman's terms so the patient understands what the doctor is saying. And that will help to calm the patient because they understand what is being said. So when you're interacting with your patients, are you responsible and dependable? Are you attentive to details for your patients? Can you be calm in an emergency? And are you responsible for your own actions? Do you tend to blame others or find fault with others? So you want to take time to answer each one of those questions and determine which areas of professionalism you could improve. So everybody has areas they can improve and areas that they excel in. We all need to do a little bit of self-inventory and find what we need to work on so that we can be better in our professional and in our personal lives. So striving to be a good professional is just going to help you go further in your career. So these are some different roles that you can have throughout the dental office as a dental assistant. So chairside assistant, when you're working directly next to the doctor or to a provider. A circulating assistant, when that's like an extra pair of hands, or they call it six-handed dentistry, when the circulating assistant is going from chair to chair, seeing what people need. A sterilization assistant is just that. They're sterilizing the instruments as they come in so that the office doesn't get behind in that. The expanded functions dental assistant is taking on extra duties. They've been assigned because they have these extra certifications. Usually the expanded functions dental assistant is placing fillings after the doctor has prepped the tooth. And then the administrative assistant or business assistant is at the front desk, and they are handling the administrative side of the dental office. For professional appearance, that is important. Can you imagine going into your dental office or your doctor's office and seeing someone that did not have a strong professional appearance trying to give you advice on how to take care of yourself? So you need to have that professional appearance for your patients so that they can trust you. And part of that is having good health, good grooming habits, and appropriate dress. So with good health, maintaining, you know, good health, good hygiene, good grooming habits, making sure that your hair is brushed, making sure that your teeth are brushed, making sure you're showering, and that your appropriate dress, your clothes are not all wrinkled and dingy looking, that you're coming to work looking crisp and looking good. I'm not saying you have to iron your clothes every day or press your clothes, but you do need to look like you have clean clothes on, that you've showered, and that you are ready to work. So with a professional appearance, these standards are here. Clean, it says pressed uniform or scrubs. I don't expect you guys to press or iron your scrubs. If you do, that's great. But they should be clean, no wrinkles, no stains. Clean, good condition shoes with laces in them. Your hair should not be in your face. If it is past your shoulders, you should have it up so that it's not a danger or a hazard for anyone. A very minimal amount of jewelry and no dangly earrings or necklaces. Clean, short nails, no artificial nails, no gel, nothing like that, because what happens even with the gel is that there's a hybrid layer there and bacteria can get in that hybrid layer and breed. Just the same with artificial nails. So you should have clean, short nails. If you're allowed to have nails on, your doctor will determine that, but really you should not have that on in the dental field. You should avoid perfume and body scents that are strong, like lotions, aftershaves, things like that. People can be allergic to those. They can cause headaches, they can cause rashes. I will tell you that I had a friend who worked with someone that wore a certain lotion and their manager was allergic to the lotion, and the girl wouldn't stop wearing it, and the girl ended up losing her job over it because the manager kept breaking out over and over because of the lotion. So you have to be curious of the people around you. You want to avoid tobacco products. They're very strong. Now, the scent is going to stay with you throughout the day. So if you are a smoker, you want to avoid smoking before work or on your breaks. And wear subtle neutral makeup at work. Avoid visible tattoos and piercings if possible. And make sure you bathe daily and use deodorant. Of course, we know that we need to maintain our oral hygiene, so brush at least twice a day and implement infection control procedures. So, these are just the standards of a professional appearance, and it's important that we come to work looking our best. For credentialing of dental assistants, DNB, or the Dental Assistant National Board, issues the credential of Certified Dental Assistant. Benefits for that are personal achievement. So it makes you feel good to know that you are a certified dental assistant, that you have achieved more than what the average person has as a dental assistant. You have not only went to school, but you have achieved above that, and you not only can talk the talk, but you can walk the walk and show everybody that you know exactly what you're doing. It promotes professional pride. It sets you apart from everyone else knowing that you have your CDA. It demonstrates commitment to excellence. it has great earning power. So your potential for earning goes up as you are a certified dental assistant. You may have a doctor or employer tell you you don't need your certified dental assistant and that there's no advantage to certification, which absolutely is not true. The advantage to certification is great earning power. You can make a lot more money being certified, and you can also add to that certification. So once you have your CDA, you can get things like coronal polishing, pit and fissure sealants, your EFTA. All of those additional certifications should earn you more money. They make you more valuable. It will help you to be able to secure more jobs that you want. So think about that for career advancement potential. So don't let someone tell you that it's not important. It is absolutely important. The first step in getting your CDA is getting your NELDA, the NELDA, which is the National Entry Level Dental Assistant. With the National Entry Level Dental Assistant, that is also given through DANB, the Dental Assistant National Board. And each of those exams are 3 components. 2 of the components are exactly the same. One component is different. They both have the radiation health and safety, the infection control. And the third component that is different is the NELDA has anatomy and tooth morphology. The CDA has general chairside. So if you take your NELDA and pass it, then you get your hours for your CDA, because it's like 2,800 hours you have to work in the dental office to get your CDA, and you can take your NELDA right after school. As long as you get your CDA within 5 years of getting your NELDA, then because of the 2 tests being the same, you only have to take the general chairside portion to get your CDA if you have your NELDA already. So the other bonus for that is that Ross will reimburse you for 2 of the 3 components of the NELDA. So the ICE and the RHS are $375, and Ross will reimburse you that $375 as long as you take it within 1 year of graduation. The NELDA total is $400. So if you take the NELDA, you will get reimbursed $375 of that $400 as long as you take it within 1 year of graduation. And that means you get a whole credential for only $25. So that's pretty amazing. So pathways to credentialing. Pathway 1, graduation from a CODA accredited program and current CPR and DMB accepted provider. So pathway 2, high school graduation or equivalent, 3,500 hours work experience, current CPR from DMB accepted provider. Or pathway 3. So what you guys would be doing is a pathway 2, 3,500 hours work experience with the current CPR from a DMB accepted provider and a high school graduation or equivalent. Because this is not a CODA program. This is an ABHAS program. So registered or licensed dental assistant. This is another credential, is a registered dental assistant, taken and passed an examination required by their state. So the RDA is registered dental assistant, and that is a credential that is given by AMT, which is American Medical Technologists. That credential is a lot less expensive, and not all states recognize it and not all employers recognize it. And you cannot add all of the extra certifications onto that, but it is good for just showing that you do, like if you don't want to add all the extra certifications onto it, then it is good to get an RDA. But I would recommend getting the CDA and the Ross does not reimburse for the RDA, only the CDA. So licensed dental assistant is license requirements vary by state, and some states require license, not all. With professional organizations, we have the American Dental Assistants Association, ADAA. Membership is automatic in the national, state, and local components. So there's benefits by joining the ADAA where you can grow personally and professionally. You can keep abreast of legislative issues and current information. And you have the opportunity to attend local, state, and national meetings. And you can participate in workshops, earn continuing education credit, hear prominent speakers, and establish lifelong friendships with other dental assistants. So again, we have career opportunities like we did in chapter 2. And these are the same. They are solo practices, group, specialty. You could be an office manager. You could be a financial coordinator, a scheduling coordinator. You could be in public health dentistry, hospital dental clinic, or a dental school clinic. So other career opportunities include insurance companies. So you could work for an insurance company as a dental assistant, and working as at an insurance company, you could help process claims because you can read x-rays and you know the dental shorthand. You could teach dental assisting, or you could be a dental product sales representative. So these are more job opportunities. Any questions? Oh, I guess not. Sorry. Thank you. Have a great day.